district, Hasso region.
Right, and we're live from Geneva, Switzerland, and Ebolova, Cameroon. This is Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbu, who's in Cameroon, and together we are welcoming you for this special celebration following World Immunization Week. Now, of course, World Immunization Week took place the last week of April. Why are we doing this event 2 weeks later? We know how busy you are as immunization professionals, hence the choice of this date. We're 2 minutes, 20 seconds away from starting. There are many immunization professionals in the room with us. You'll see an incredible event awaits us with 845 photographers who contributed to the exhibition that we're going to inaugurate today. But you will see the photographers are immunization professionals documenting their own lives in their own words on their own terms. We'll be introducing this event in less than 2 minutes. Stay tuned. One minute and 10 seconds before we launch this celebration following World Immunization Week. You'll hear immunization colleagues from all over the world sharing their experience and showing with the power of visual storytelling what it means to make vaccines work and to be involved in the big catch-up, as we call it, following the consequences of the COVID-19 pandemic, heading towards the goals of every country in the world has agreed to reach by 2030. 40 seconds, and we're almost there. Together with us in our Zoom studio are leaders of the movement for Immunization Agenda 2030, IA 2030, and that's the world strategy. And we're 20 seconds away. You can do the countdown with me if you're sitting alone in front of your computer screen or with colleagues perhaps. Here we go. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki. Very pleased to be here together with Charlotte Mbu, also from the Geneva Learning Foundation. How are you doing, Charlotte? How are you feeling? What's one word to describe how you feel?
Excitement.
All right. And we're excited because 845 now photographers contributed to the exhibition. You may wonder what photographers, what exhibition, that's what we're going to tell you. But the photographers are immunization staff who've documented their own lives in their own terms. And that's what we're going to do today, is to share some of those locations, 964 different places throughout the world where immunization takes place, where immunization staff make vaccines work during a particular time in history. Now, the first time we did this was on the 2nd of May 2022. And this was quasi-spontaneous. We had just launched the movement for Immunization Agenda 2030. And on the 2nd of May, we held a special event. So just a little bit over a year ago, over 1,000 immunization practitioners had shared photos documenting their daily lives. And I'm pleased to say today that once again, today we're inaugurating the second photo exhibition of the movement for Immunization Agenda 2030. And you'll see this year contributions by country. Again, the same numbers, new photos, new situations. You can see the first half of the list of countries here and the second half here. Some countries only have one photo, others have hundreds of submissions. Whatever the case may be, you can be proud to be the one who submitted that photo, and it is not too late to share. So we're going to start by turning to the room. I see we're going to ask for the movement leaders who are here with us to raise their hand in order to explain what photo you shared, what and where the photo was taken, who is in the photo, why you shared it, and how you contribute to confidence in immunization. So I'm going to turn to Charlotte to choose. So again, if you are in our Zoom studio, you can raise your hand and we'll turn to you to hear directly from you what photo you shared and why.
Thanks, Reda. So while we are waiting for some to raise their hands, I'm just going to invite others. I want to turn to Dr. Kanwal Shakil Koja. I don't know if you're able to unmute yourself. I'm asking you to do so. You shared a photo from Pakistan. If you're able to unmute yourself and comment on that photo, that would really be great. Dr. Kanwal Shakil, are you able to unmute yourself? And I'm also inviting others in the room to go ahead and, okay, we also have Ikram. So Dr. Kanwal has unmuted. Afterwards, we'll turn towards Ikram, Reda.
All right, wonderful. So let's look at Dr. Kanwal Shakil Koza's photo. So you submitted this photo as part of the big catch-up call from the Movement for Immunization Agenda. Actually, there's several photos, and you're monitoring polio teams on the ground, taking house-to-house cluster and counseling cases of refusal. People at ground level listen to the medical doctor visiting the households, you told us, and counseling them against refusal of vaccination. This is in District Korangi in Pakistan. Dr. Kanwal Shakil Koja, a warm welcome to you. What would you like to tell us about this story that we cannot tell from the photo itself? What's happening? What was surprising? What was interesting about this moment that you captured on film?
Hello, good morning, good evening, and good afternoon. Hope I'm audible to all.
Yes, indeed. You're loud and clear.
So this is the usual photograph which was taken when I was visiting field, and I was monitoring teams and I was taking clusters during the polio campaign. Also, in my routine work, I also do EPI center visits and do monitoring at the field level for the teams, fixed site transit teams. So this photograph also shows the refusals which are converted, which actually do not want to vaccinate their children for the polio and other antigens. So we counsel them. So this is basically the work which we do on ground. That's all from my side.
All right, understood. Thank you. And what's your biggest challenge on the ground when you do this type of work, Dr. Kanwal?
So basically, we have a lot of refusals regarding vaccines, especially for the polio vaccine and other antigens, because most of the time we get that they don't want to vaccinate. The parents do not want to vaccinate their children. So this is the bigger challenge which we face on ground.
Okay. And what brought you to the event today? I'm sure you are very busy with your work. Why is it worthwhile for you to come share and listen to the experiences of fellow immunization practitioners?
The reason that basically I always support the idea of vaccination. And I feel that by vaccinating children, we can prevent diseases. So that's the major reason. I am also a public health professional. So that's the main reason that I want to work in this domain.
Wonderful. Thank you so much, Dr. Kanwal, for being the first to share from Pakistan. Again, immunization practitioners from all over the world are sharing their stories. And there was a man who shall remain anonymous from a district who works for the Ministry of Health in Ghana, who said the following at the last Teach to Reach, our regular event for networking between immunization professionals, who said, if health workers do not share their challenges and solutions together, we are bound to fail. And that is a spirit, not of failure, but of success together that is bringing us together today. We have questions today, so it's actually 4 sort of question sets today. Why do you work for health? How do you reach the unreached? What works for HPV vaccine? And what works for oral corollary cholera vaccine, OCV? Those are some of the questions that we're putting before you. And these are the reason we're asking these questions is in part because many of your photos addressed these issues. And we look at all of these under the overarching theme, the big catch-up, which is the theme for this year's World Immunization Week. Last July, UNICEF and WHO announced that the COVID-19 pandemic is fueling the largest continuing backslide in vaccinations in 3 decades. And that is why we're talking about the big catch-up today. Back to you, Charlotte, for our next speaker.
Thank you, Reda. I know we have some rules of equity, but because it's always good to listen to our female voices, we already have Loretta Ahokpeme, whose microphone is open, but I'm sure after Loretta, we'll go back to Ikram Hamid.
Wonderful, Loretta. A warm welcome to you. Tell us who you are, what you do, now, I believe your picture is not online yet. So you submitted a picture. It's not online yet. So you're going to have to describe it to us and tell us what you are doing where you are once you've introduced yourself to help families catch up on missed vaccinations. Loretta, are you able to speak to us? It sounds like she has an issue with her microphone, Charlotte.
Yeah, that seems to be the case, Reda, unfortunately. Right. So we'll have to listen to Ikram.
All right, Ikram, over to you, and I hope we can find your photo. There's so many photos, we were swamped. So this is a wonderful thing. Ikram, you're in the same situation. Your photo is not online yet, but I'm going to show you where you'll be able to see it when it comes out, and that is by going to the Geneva Learning Foundation's Instagram channel. You can see here that there are already hundreds of photos that have been published and hundreds more to come. So we're holding the event today. We did not expect this many photos to arrive. Ikram, please tell us who you are, what you do, where you work, and then tell us about the photo you shared and what you're doing to help families catch up on missed vaccinations.
Yeah. Hello, everyone. Good morning, good evening, and good to all from all over the world, the immunization family. I am Ikram from Maldives. I have been working with the National Immunization Program as public health professionals, and we have been actually in Maldives. We have during the COVID-19. I have shared photo the vaccination during COVID-19 days. So what we have done actually, the missed vaccination during COVID-19 pandemic, actually a kind of different. Maldives is like a group of islands, a form of group island. For us, it was not that much difficult situation for routine immunization too, because we have like a timing for each for COVID-19 vaccination as well as the routine vaccination. So our we have, even in COVID-19 days also, we have been the coverage was more than 90%. So I think, and we are actually catch up on the missed vaccination too.
Okay, that's good news, and that speaks to the big catch-up then. What is the biggest challenge that you face today, Ikram?
Actually, the vaccines transportation is the biggest challenge in Maldives during the pandemic. So because Maldives is 90% of oceans, where thousands of islands are connecting each other. Even the income is from resort tourism. So tourism, we have actually provided COVID-19 vaccination for tourism sectors too. So that means uninhabited islands and as well as the tourism islands. Also, we have provided. The thing is whether the sea. We have got a 2 monsoon, with the rainy sea rough. In that case, actually a bit delay in the transportation of vaccines, but we manage actually without having we have managed actually well with a great team in Maldives.
Great, thank you, Inkrab Hamid from the Maldives. Warm welcome to all of you joining us from all over the world. Over 8,200 immunization professionals joining for this event. And we have, let me see, over here, Wai Ling Ong from Myanmar. So let's go to Wai Ling. I hope you'll be able to speak to us. Wai Ling, I'm asking you to unmute. Yes, warm welcome to you. So you work in... Yes, you work in the northern Shan State cold room in Myanmar. So tell us about that. Why is logistics management crucial?
Yes. That was the photo one I was taken in my previous work. I was working in WHO I have to take care of the cold room for the logistics supply. And then this is the first arrival of COVID-19 vaccine for Myanmar. And that is the day. Tomorrow we will give the very first vaccination of COVID-19 at the time. So I was responsible for the management of the cold chain at the time and vaccine distribution. This year, I changed to the location where the conflicts are affecting frequently and largely, which is called Rakhine State. I worked there for immunization too as an immunization officer. Here in Myanmar, after pandemic, most of the country are eager to raise the immunization coverage strongly. But in our country, after pandemic, there was a very big coup. Military take the power from the government. Therefore, there was a very big impact on healthcare sector because most of the healthcare workers follow the civil disobedience movement. Therefore, the health workforce is very insufficient in Myanmar after pandemic. So the immunization coverage was nearly zero at the time. So we need to start from zero at the time this year. So I work as an immunization officer to promote, to develop the demand generation in the community worker. The biggest challenge is that there was no big support for the vaccine transportation of immunization activities. So we plan to support for the vaccine transportation and other activities. So we started to give the support in 2023. So most of the unreached and most of the uncovered area got the vaccination again after 2 years. So this was our team achievement. Thank you.
So Wai Ling, a question for you. You are smiling. You've just described some very difficult circumstances. What is making you smile when this picture is taken?
Yeah, at that time, our country is a democratic government before a week to coup. After the coup, most of the people are very sad, and every problems that came up surprisingly. At that time, we are active, energetic, and all the people, all the health workers, as a doctor, nurses are very active, happy to serve the government at the time. So I was smiling at the time, very happily.
All right, yes. Thank you. Wai Ling Ong. Many of you we know work in situations of conflict of different kinds, so it's good to hear that firsthand storytelling and that the work of immunization is able to continue despite such challenges. Now, on the 28th of April, 2021, we asked you a simple question: what is the future of immunization? And this was after the World Health Assembly adopted unanimously Immunization Agenda 2030, the world strategy mapping out how we are going to reach the goals of immunization. That actually happened before the COVID-19 pandemic. In March 2022, we launched a call to join the movement for immunization. And on 7th of March, over 6,000 health professionals from 110 countries committed to contributing to a global movement. Now, I'm pleased to share today that a little bit over a year later, we are now, believe it or not, over 50,000 immunization professionals active on the Geneva Learning Foundation's platform. Most of you work at the subnational level, and it is not so much about what we from the Geneva Learning Foundation shared with you here. You can see social networking analysis of the relationships within and across leaders of this movement for immunization. Now we come to the big catch-up, and we ask you through these photos, through this new photo exhibit, the second time we're doing this, and this time we're asking you, what are you doing? What did you do to help families catch up on missed vaccinations during the pandemic? Back to you, Charlotte, to select the next speaker. I see many hands raised now. Wonderful to see. Looking forward to hearing more stories, more experiences shared, and the images that tell them.
Definitely, Reda, and I want to say we are sorry that Loretta, you are not able to, your microphone is working, but you actually shared the story behind your picture in the chat. Are you able to speak to us again now?
Hello, good morning, good afternoon, good evening. Am I audible? Over.
Is Ismaila Edego. Okay, over to you, Ismaila. Ismaila?
No, I think.
Can you hear us?
I think both are having connection problems. So let's keep going. There's lots of people who have their hands up. Go ahead, Ismaila. Tell us about your photo. And again, if you haven't seen it yet, it's you need to go to the Instagram or Facebook.
Can anybody hear me, please?
Yes, we hear you. Can you speak louder, please, and closer to your microphone? All right, Charlotte, I suggest we move on as both of them seem to have difficulties, and that's fine. That happens to all of us. I see Rebecca Kello. I see...
Good morning, good afternoon, good evening. Mr. Reda?
Yes, Ismaila, you're coming in very faint. We struggle to hear you. Can you speak up, please, and speak closer to your microphone?
Hear me over, please.
All right. Unfortunately, Ismaila, I don't think we'll be able to speak to us as having connection problems, as many of you are. Let's keep going to Priyanka Bajaj, Mohammed Wajid Ali, Professor Becky Tagbo, Mohammed Taimur. You are all movement leaders. We know of you. Priyanka Bajaj, we'd love to hear from you, and then we'll go to Professor Becky Tagbo. All right.
We make a list of we conduct meetings with the Anganwadi with the frontline workers about we conduct meetings with the frontline workers about what the vaccination in their children's are in their area, and they track about the vaccination record of their children's, and we also monitor by the field visit of them. Then we try to cover the missed immunization as much as possible.
Thank you, Priyanka, for sharing. And can you repeat where you are based? I did not catch where you work and what you do.
Sorry, I myself Priyanka Bajaj from India. I am working as a vaccine cold chain manager in Delhi.
Wonderful. All right. Thank you. Let's now go. So Priyanka, as with many others, it seems here we're here today. We've already posted hundreds of pictures, but there's almost 1,000 this year to add. So if your picture has not been posted yet, so I encourage you to go scrolling through the Instagram feed here. Have you seen your picture yet somewhere? Or if not, I would encourage you to keep looking, and also as we said, express your solidarity by connecting by liking and sharing the photos of your colleagues. Thank you, Priyanka. Now,
yes, I have found my photos on this link in Geneva Learning Foundation, this website, and I'm glad to find this. I'm really thankful to you for encouraging us.
All right, wonderful. Thank you, Priyanka, for your commitment and dedication and the work you do every day for immunization. Now over to Professor Becky Tagbo. You are a figure in the Movement for Immunization Agenda 2030. A wonderful, warm voice, contributing and expressing solidarity, supporting others, and giving and receiving support. Professor Becky Tagbo, do introduce yourself once again, and then it looks like I'm going to ask Charlotte for help here, because once again, Becky's picture is not, I believe. Oh, wait, is it? Does not seem to be on yet. So I'm hoping that is wrong, but I can't seem to. No, it doesn't seem to be on. So you'll have to tell us about it, and then we'll go look at it as more and more photos get posted. Professor Becky Tagbo, over to you.
Thank you, Rada. Thank you, Charlotte, and everyone. I hope you can hear me.
Loud and clear.
Oh, it's a nice thing again, meeting with everyone in this wonderful place. I've checked for my photo. I haven't seen it yet. I hope it will come out.
It's coming.
But it was just a photo of me in my office. I work at the Institute of Child Health, University of Nigeria Teaching Hospital. And we do a lot of things regarding vaccines there. We conduct vaccine surveillance. And we also immunize children. We carry out outreaches, advocacies, and the public enlightenment. But I would like to just share one thing that happened recently. In the course of our surveillance, a child that was admitted for surgery, we wanted to get the immunization card so we could record, only to discover that the 6-month-old baby had not been vaccinated. It was a 0 dose. This was last month. And on further inquiry, we discovered that the mother refused vaccination because, according to her own mother told her that vaccination was what deformed her leg because the mother limps. And this was a very pathetic story. So we had to go the first time to convince her. She did not give in. We went the second time. I think it was the third time we had to explain to her that probably this was in a remote area. It was like the injection was not properly administered. And so she had some paralysis. So she was limping. So at the end, we were able to convince her and we gave the baby all the vaccine doses that the baby was due. And we were all so happy, gave her her card and then gave her appointment. We collected her details, her community, and we're now tracing her back to her community. We are connecting the health worker in that community and to see if there are other 0 doses in that community and then for them to be able to follow up properly on discharge from the hospital. And I feel so happy. I discovered that this same woman also suffered gender violence. She also suffered discrimination from her disability. And she was a very poor woman whose husband had abandoned in hospital. And so I encouraged my team and motivated them. And we all started contributing money to help her start up a business so she can take care of herself and her baby. I'm so happy to share this story. Thank you.
Thank you so much, Becky. And will we be seeing this family, this baby in the photos that you've shared?
I haven't put her photo yet because I've not got her consent.
I see, I understand. Yes, and that is indeed very important. Now, if health workers do not share their challenges and solutions together, we are bound to fail. Now, we haven't been very successful, Charlotte, at connecting stories and speakers with photos that have been posted already. Have you, and speakers who have good connectivity, have you been able to identify one or more people who are in a position to share whose stories and photos we actually have?
Reda, we have some people whose hands are not raised, but whose photos I think we have.
All right.
Like Mataji Ubale Ado, I'm asking you to unmute if you're able to. But we could also listen to Mohammed Taimo. Mohammed Taimo already has his microphone open.
All right, wonderful. However, we don't seem to have Mohammed Taimur's picture either. So what I suggest we're going to do, let's hear from Mohammed, and then we'll go to the actual slideshow. And as we show some of the slides, then Charlotte, you can identify who is actually in the room, whose pictures we do have. There are many Nigerians, but also many other nationalities represented. Mohammed Taimur, a warm welcome. Tell us about your picture, please.
All right. Thank you very much. I would like to congratulate the Geneva Learning Foundation for yet another successful event, mashallah. This is Dr. Mohammed Taimur. I'm basically from Team Pakistan, currently serving with the WHO Regional Office for the Eastern Mediterranean and currently based in Mogadishu, Somalia, supporting immunization, VPDs and COVID-19 vaccination. So my picture actually was related to the review we were doing. Like since I came here some 7 months ago, in COVID-19 vaccination, Somalia had a target to achieve 48% of their total population. And they, being a priority country in the region, it was only 16%. With the support of many, like more than 10,000 mobile teams, we were able to vaccinate 45% of the total population against a target of 48 by now. Second thing is like for immunization, for EPI, there were many security issues. So many inaccessible areas were there. But luckily now, like we have improved the indicators for EPI as well. And I have the honor to prepare the national guidelines for vaccine-preventable diseases in Somalia and for adverse events following immunization as well. So this is the only second country in the region which does not have case-based surveillance for measles after Afghanistan. And hopefully within a couple of months, we are planning to just, establish them. And we would be having good, like surveillance for measles as well. And furthermore, like we have got the certificate and we are planning to introduce the NOPV2 to reduce the circulating vaccine-derived poliovirus burden here in the country as well. So there are many more things to say, but I guess time to, give chance to others as well. Thank you and over from our side.
All right, wonderful. Thank you. All right. I see in the room we have a Chris Debode, who is a fellow of the Geneva Learning Foundation. I'm going to let him introduce himself, but first let me show you. So Chris Debode is an award-winning photographer. We asked him to share his reflections, being a visual storyteller, about what it means that last year, for the first time, almost 1,000 immunization professionals shared photos of their daily work. Would be lovely to hear from you, Chris. As you've been looking, I know, at this year's new photos coming in for this inauguration of the second photo exhibit of the Movement for Immunization Agenda 2030. But please do introduce yourself, and would love to hear your reflections live as well as in writing.
Hi, everybody. Hi, I'm Chris Debode. I'm live from Amsterdam as we speak. And I'm overwhelmed by all the images I've seen online, and overwhelmed not only the amount of images, but also the quality. And I'd love to make a big compliment to all of you. And very, very well done. It's impressive.
Chris, can you tell us what you find impressive and well done? Most of the people who submitted the picture, they took a picture of what they do every day. So what's special about these photos?
Yeah, well, in fact, I'm a photographer since, I think over 30 years. And I traveled the world. I've been in lots of places. And I have to say that whenever I get to somewhere, I always have to deal with the moment, something which is happening while I am there, And so all the other days when I'm not there's a lot of things going on. And the good thing that you people take pictures of your daily work, your daily life, is that you're able to come closer to what you think is important, and you decide what is important, and not me being the professional photographer. And that's what I really love about this exhibition, this project, and you non-professional photographers being involved and showing your images to the world.
Wonderful. Thank you, Chris Debode. You can find Chris's reflections I've shared on our LinkedIn page. I've shared the Geneva Learning Foundation. I've shared the link for those of you who are with us in our Zoom studio. I hope that Charlotte has got more speakers. We'd love it. This is your event. This is about listening to your stories, sharing experiences. Of course, the overarching theme is the big catch-up, but we have many. We want to know why you work for health. How are you actually reaching the unreached? And then two specific questions, one on HPV vaccine and oral cholera vaccine. But back to you, Charlotte. Who shall we hear from next?
So Reda, you said we're going to go through the photos and then we'll pause when there is someone. I want to see if we still have Hawa Buhari in the room.
Because she was there before with a good connection, right? So it would be ironic if...
Actually, she's still here. but I'm asking her to unmute. I hope she'll be able to. Her connectivity will allow her to do that.
All right. And if not, let's already show her picture. Let me see. So Hawa shared a picture from Gidander settlement. Hang on, here we are. From Sokoto State, Nigeria. And it says, this photo shows me and some colleagues from the nutrition section carrying out a community outreach assessment of CMAM. This activity was carried out at the Gidander settlement to measure the level of malnutrition. Children under the age of 5 are measured for height, weight, and MUAC. I help the community in the areas of sensitization, mobilization, and linkage. Hawa, a warm welcome to you. I see your microphone is unmuted. I'm really, I hope you're going to be able to tell us more than what we see, even though a picture may well be worth 1,000 words.
Good evening, colleagues. I'm happy to be able to say a few words about my picture. Actually excited I can find my picture. Okay, this was a picture taken in 2021, where we had one of the immunization sessions we discovered that there were actually children suffering from acute malnutrition in the community, which added to the fact that we kept having outbreak of CVD in our community. So for UNICEF, there's this kind of harmonization across sections. So we reached out to our nutrition colleagues so that we can be able to at least help these children. Because when you give out immunization without good nourishment, we have issues whereby the stereotyping is good properly. So this is me supporting the nutrition section, carrying out, we take the height and the weight of the child according to their age. If they were really undernourished, give the caregiver proper advices, and in events that we have children are actually malnourished, we link them up to the UNICEF project whereby we give supplements for acute malnourished children.
And how so? You work here for for UNICEF, if I understand correctly. Did you go in for immunization and ended up helping for nutrition? Is that what happened?
Yes, actually, I'm actually under SBC. So for SBC, the joy of being under SBC is that you get to link up with all sections. You get child protection, you get education, you get immunization, and nutrition aspects. And the wash clothes are also there. So we link up with all sections. So we're like the heart of UNICEF, if I may say. So we link up all these sections and support. For us, we're activities in the community, we find all these issues and then come back to the table, tell our section lead, okay, this is what we found out, and this is where I think the wash clothes can come into play. This is where I think the nutrition goes and come into place, and then we harmonize and do all this. Or by and large, I think maybe 80% were together with the immunization team. So we there's this transition from the polio team, and then we went towards the polio and down. Or really doing integration with other sections.
Understood. Thank you so much for sharing. And this time we finally, so don't despair. This happens. We could not predict who would have good enough connectivity today at this time in order to share your photos. So do not despair. If you didn't get to share your picture, please do keep looking on our Instagram feed, and of course express your solidarity by liking and sharing the photos of your colleagues. Harira Suleiman has a picture. I'm asking Harira to unmute. Says, and the story is, this is the immunization data validation. Immunity is boosted if the vaccinated children compared to unvaccinated ones. Harira Suleiman, are you able to speak to us? It looks like we have another connectivity problem, and that's okay. That will happen. I think what we're going to do, Charlotte, is go look at some of our favorites. And if you are in the room, please do raise your hand if you see your picture. You'll see there's some remarkable pictures, photos here. There's one from Omolara Adeyemi. This is Makoko Riverine community, so vaccinating children in a polio supplemental immunization house-to-house campaign. So this is a shanty community in Lagos. Banyona Monomosi Lucy from the Democratic Republic of Congo. So it's a free family planning service with the support of midwives. So they do integrated immunization together with breast cancer screening, HIV testing.
Yes,
right?
Reda, and
yes.
I just wanted to comment a little bit on the previous pictures because many a times we forgot that childhood immunization actually starts when the baby is still in the stomach of the mother with the tetanus, the tetanus, the anti-tetanus vaccine. So that is one of the reasons why this picture actually spoke to us, because it talks about integration.
Indeed, absolutely. So Friday in Nkoma from fish. This is a fishing camp in Zambia. So during a polio national campaign, and the mother is in the picture is a fishmonger, and her child missed the polio vaccination campaign which was still going on. So picture taken at the Mukuku Bridge on the Luapula River, the fishing camp market. And there again, integration, I bet, Charlotte, is what you had in mind, because there's also an outbreak of scabies among the under 5 children in the area. Is that
and
why?
Also taking advantage of the SIA campaign, that the resources that the campaign makes available is an opportunity to identify and reach zero dose and missed children.
All right, wonderful. Let me see if I see we still have many hands raised. I'm still trying to match photos with people. We heard from Dr. Kanwal, who was on our short list of photos. Sadiq Nasiru Garba took a picture. So this is again in Nigeria, in Ikra Nursery and Primary School during a measles vaccination campaign. Charlotte, what struck you about this photo?
He talked about a private school where they used to have that is hesitancy against vaccination. They had to go in and discuss and negotiate, and to the point where the school accepted vaccination and also started implementing one of the recommendations, that is that children present their immunization cards during admission to school. So I thought that's a story that, using a campaign to solve a long-term issue that has to do with acceptance of immunization services.
Indeed. And as a reminder, if you're just joining us now, this is the inauguration of the second photo exhibition of the movement for Immunization Agenda 2030. So I've lowered all the hands and done another call. If you'd like to share your a photo. Now, your photo may not be posted yet, but we don't want to discourage you from sharing. You'll have to describe it to us. And then, of course, we have hundreds of photos that will be posted in the coming days and weeks. Noura Abubakar, would you like to tell us about your photo? Or Usman Mohammed Tukur?
Yes, thank you so much, Reda.
Yes, please go ahead.
My name is Usman Mohammed Tukur from Nigeria, Kano State. Even though I didn't show my pictures, but I share it. But let me just describe the picture.
Yes, please.
Yes, actually, we are working or intervening in a community where we are actually helping in solving zero dose at the community level. So each day when we enter the community level, when we come back to our station, we normally have a review meeting from different angles of the community so that we should have different observations, and if there's any innovation, then we can adopt it. So actually, there's one particular community where we have a serious case of zero dose because we detected from low coverage from that particular community. So actually, we went there, we sit down with the community structures, we discuss what is the actual problem, why there is low coverage, and why there is issue of zero dose in their community. So through that intervention of the community structures and some LGA officials, we identified so many issues. Part of it is lack of involvement of some communities in some activities, especially that are involved governments. So we really intervene, we call the concerned person for the action. So he quickly arranged another time for us to went to that community and discuss the issue with the community structure. So we go there and sit down and discuss. They itemize all their issue, and all the government officials that are there, they take note about the issues and they promise to them to solve that issue. And all the community structures, they were happy and they encourage us to come back so that they should go and talk to the household concern where they have 0 dose and those who refuse non-compliance issue to accept the vaccine. So had there been my pictures in there, you will see I'm happy at that time because we solved the issue through simple way by just intervene and communicate, make just sensitization visit to the community of 0 dose. Thank you so much.
Thank you very much indeed. Okay, I'm very pleased to see to hear this. Mariama Idris, also from Nigeria, and we really honor Nigeria. Nigeria, if you saw in the numbers, submitted more photos than any other country in the world. But Mariama's picture stands out, and she says in a little office in Zango ward where she works, and she says, "What I do to increase confidence in vaccines within the community is making sure I vaccinate health professionals in front of community members." Mariama, a warm welcome to you. How are you? First of all, do introduce yourself and tell us the story. Who is that you in the picture? Who is the man that you're vaccinating? Tell us what's happening here and why you shared this picture for World Immunization Week.
Hello, good evening. Thank you very much. I am Mariama Idris from Kano State, Nigeria. I worked as a health community worker in the Zango ward. In this picture, this is showing me and one health worker, although he has actually refused to be immunized because of vaccine hesitancy. I managed to convince him and now he agreed. Some of the community members are watching me, giving him so that I can be able to build confidence in them to accept being immunized. This is Zango ward, Kano State, Nigeria. Thank you. I'm happy to be here. Thank you very much.
Thank you, Mariama. And can you tell us what were the words you used when you spoke with your colleague to convince him? What made the difference? Why did he trust you on what you told him?
Actually, I was one of the COVID-19 focal person in my ward. And since the onset of this COVID-19 vaccine, I have been giving it. I vaccinated, and through the surveillance, there's no any emergency cases. Nobody reacted, no sudden death whatsoever. So I already partially built the confidence in them, but only for them to accept fully to be immunized. Some accept, some still have vaccine hesitancy, and eventually I conquered, and they eventually agreed that they will be immunized, and the community members too agree with me. This is the method I use for them to convince them so that they can accept. Thank you very much.
Wonderful. Thank you, Mariama. And you are far from the only one. We know many health professionals have vaccinated themselves in front of community members to show that the COVID-19 vaccine is safe and effective. I want to thank you and others for what you're doing. Now, I see hands raised, Charlotte, but unfortunately, from my checking, the individuals who raised their hands, their photos have not yet been posted, but do not despair because very soon your photos will be published. Remember, we were overwhelmed. We received 845 photographers, immunization staff who took pictures, 964 locations shared. Charlotte, who shall we hear from next?
Right up, we have Ibrahim Abdullahi Maikano. I don't know if you're able to unmute yourself. You have some photos that you shared. Would like to hear the story behind the picture. Ibrahim Abdullahi Maikano. And it's still honoring our Nigerian community.
Yes, all right. And that is fine. And we're proud of the Nigerian community of scholars. We invite scholars and movement leaders from other countries. So Ibrahim Abdullahi Maikano, I believe you shared more than one picture. This is the first one that I found from Mac Dallas Center during the reactivation of a state and LGA rapid response team on VPDs, so vaccine-preventable diseases. So everything from Lassa fever to COVID-19. and you are there giving a presentation. Can you tell us who you're presenting to and what is happening? What is the story here? Why is this important enough that you shared it with us? Oh, and of course he's gone mute again. I don't think, Charlotte, we've ever had this much, this many difficulties. Okay, good. Ibrahim Abdullahi Maikano, the floor is yours. What's happening in the picture? Why is this an important story?
Okay. Good evening, Reda. Good evening, Charles, and all members of TLG. I am Ibrahim Abdullahi Maikano, Director, Primary Healthcare. Really, I've shared my picture with the TLG. For immunization movement, while I'm giving a kind of while I'm facilitating on the importance of Lassa fever and challenge we had from the state down to the local government, with particularly case of Lassa fever. We are having an outbreak in some of the local government, including Kirfi local government where I'm working. And as you see me standing and trying to present on the quality issues and way forward on how to prevent the occurrence of any vaccine-preventable disease, including Lassa fever in particular. And as well, trying to look at the quality improvement plan on how we can improve our immunization status coverage in Kirfi local government of Bauchi State. Thank you once again.
Thank you very much indeed. And tell me, from listening and seeing the photos of your colleagues from all over the world, including many fellow Nigerians, you are a deputy director of primary healthcare, so quite a senior position. Why take time out? You must be very busy. Why take time out to share a photo and then take more time to come join this event? What do you gain from participating in an event like this?
Really, the interaction and expertise colleagues that we share knowledge and information is one of the best, something that I used to enjoy there. And from the look of my picture, you can see that I'm standing on front of some are working from the partners, some are working from the ministries and other health facility in charges, including other healthcare service providers, that I'm trying to present a kind of quality improvement plan in front of them. So with the knowledge gained from immunization movement and interaction we had, definitely I enjoy and I gain most of experience and knowledge which I used to share with others that really helps in preventing quality health services in my state. Thank you.
All right, thank you very much indeed. Now, there's a very striking picture that was shared by Dr. Ndayo Akpaniwat. Because of our rules on fairness in public speaking, I'd like to invite a non-Nigerian to share this, to share their thoughts upon seeing this, because it's quite explicit. Dr. Ndayo says, during one of our unscheduled facility monitoring visits, we encountered this accumulative, unacceptable, poor immunization waste management. Used and unusable vaccine vials were not sanitarily managed in this facility. We immediately organized an evacuation and proper disposal on the same day, with the development of a regular pickup plan to forestall accumulation. Assurances on vaccine safety and waste management are an important part of the efforts to create awareness on general safety measures for both the personnel and clients. So once again, we appreciate our Nigerian colleagues, but ask you, I'm going to lower all hands and ask colleagues from other countries to have a voice. We may then go to Ndayo Iwat to share his thoughts. If I saw that Priyanka Bajaj, who we heard from earlier, would love to hear from India again. Priyanka, I'm asking you to unmute, and would love to hear you share your thoughts on a situation like this where there is, we shared a lot of positive stories of vaccination happening, but in the Ndayo Iwat documented something that is less pleasant. And if you'd like to comment, of course, if you're not from a country other than Nigeria, it would be lovely to hear from you. Deborah Tembo, I'm asking you to...
Hello?
Yes.
Can you please repeat the question?
Yes, so here we have a striking picture of bad waste management with vaccine vials that are not being managed properly in this facility. Priyanka Bajaj, what is, when you see something like this, in another country certainly, but it could be any country, what are your thoughts? We've shared many positive examples, but in the face of something like this, how does that make you feel as an immunization professional?
I think biomedical waste is not managed properly. How the medical facilities are doing, what the suggestions on that, what they have thought, what they thought, how they will dispose it. It can harm anybody, and it should be taken seriously.
Understood. Yes, indeed. And Deborah Tembo, you've also unmuted. Would you like to comment? And this is, this could be any country. Remind us, introduce yourself, tell us who you are and what you do, and what are your thoughts when you see a situation like this, a clear example of poor waste management in immunization?
Thank you so much, Rada. This is Deborah Tembo. I'm in Zambia. I'm a national polio consultant. I've been working with the Immunization EPI organization in Zambia. And before that, I was part of the teams who was doing actual immunization at lower facility levels. So this picture is indeed saddening, looking at how we are supposed to ensure that we manage biosafety. And for issues like if you are doing with polio vaccines, especially NOPV2 and others, you need to ensure that they are properly managed. Even the disposal, everyone has to observe, as they pose a lot of dangers, including to the environment. So this is something that as immunization activities are going on, and as we are monitoring and ensuring that teams work properly, we are also supposed to check these disposal activities also, even as we are monitoring the cold chain and others, because if we just leave it like that, we may be able to have outbreaks from such activities. So we thank the team that was able to look at this and be able to advise. Thank you, Dr. Ndeayo, for the action and being able to take prompt action and putting up measures that this won't be able to occur again. And I think all of us will be able to look out for this as we are conducting different monitoring different sites. Thank you, Rada.
Thank you both. So, Dr. Ndayo Iwat, you heard perspectives from India and Zambia in response to this photo that you shared. Most people shared positive photos showing how they are making vaccines work. Can you tell us why you shared this photo and what your thoughts were upon sending it?
Thank you very much, Reda. I'm so pleased to be on this meeting at this time. And I want to say that, Reda, that your voice has changed, your appearance has also changed, coming from the last meeting I saw you hosting live. I'm very happy to be around again after a very long break. And Charlotte, so thank you very sincerely. I had to post this picture, and you can see it's outside what we are posting here. It's about waste management, which is very critical to me, and I know to every immunization professional. The first thing is this: we spend so much time running after zero dose and so on, forgetting that the environmental effects of empty vaccine vials, the environmental effects could be disastrous, could even reverse all the gains that we have made so far. For instance, the circulating virus, vaccine-derived poliovirus, we will agree, can also come from wash off from this. And other live attenuated vaccines could also be very dangerous out there, apart from the effect of the vials, the empty bottles that are broken here and there. So, and the nuisance effect. And two, we consider what our vaccination personnel think. They approach vaccination in a task team approach. The policy and guidelines, the protocols for all these things are there. All the countries, I'm very sure, they have the massive support that we have from partners, Gavi, UNICEF, and so on and so forth, supporting us in vaccine vaccination planning and execution and monitoring. But then when it comes to field work, because of paucity of staff, you recruit volunteers. They will be out there. They are interested in vaccinating. They don't care about. They don't remember the protocols for waste management. Then, thirdly, we are looking at the situation that waste management programming should have a final disposal plan. That is from the service point. You have to collect all this waste from vaccination and then pull them and have a plan to where they will be finally disposed of. So that last mile of having to dispose of this waste is usually not carried through because either the officers involved are not particularly mobilized in terms of logistical support, or they don't remember that their time has come that they did.
Thank you.
Into action. And fourthly, sorry, thank you so much.
Yes, please conclude.
So, in conclusion, I want us to also add this to. I'm very happy it has been added to the album, and it should be shared and circulated widely for people to also learn from the bloggers of implemented here. Thank you for the interest in this, and then opportunity for me to speak to the world-class audience. Thank you.
Thank you very much indeed, Dr. Iwat. Some other remarkable pictures that that we shortlisted. And if you haven't seen your photo, if we couldn't show your photo today, please do not worry. Photos will be posted very soon. Yes, Charlotte.
I really like to make a comment of this photo after the one that we saw Dr. Ndayo share, because what was captivating to me was how organized the cold chain equipment is. But beyond that, all of the charts on the wall showing monitoring of data, which is a very important aspect of immunization service delivery.
Great. All right. Thank you, Charlotte. There are many great comments about why we selected these photos. This picture, we're not going to have time to comment on each one. This one is from James Sato, taken during an RI intensification exercise and outreach session to vaccinate zero dose. Samuel Majang Moot during a tetanus campaign in South Sudan, delivering supplies to the other side of Chuopi River, crossing on the canoe. Sitana Ahmed El Sayed Ahmed. This is again this is actually in Sudan, not South Sudan. Douai locality in Cameroon. This is Bridget Mugang. Dr. Danisha Danan, Chinchwad, Maharashtra, India. Mohammed Hashim from the Punjab district line in Pakistan. Harira Suleiman, we discussed this one. Ala Ramaji Mainbi from Chad. Naila Dugan from Lebanon, showing breastfeeding course education importance and emphasizing the importance of maternal immunization. Boboy Health District in Niger, and Dr. Gloria Archibong from the Comprehensive Health Center in Gaboko, Nigeria. Now, it looks like there's almost a perfect mismatch between the photos that have already been posted and the individuals who've come today. That sometimes happens. I don't think, Charlotte, it have ever happened to this extent. But I'd now like to introduce what's coming next, as we're 1 minute away officially from the closing time for this special event, and then we'll be going through many more of the photos and stories that have been shared, the ones that have already been posted. But the most important thing is that if you haven't found your photo, keep looking, keep checking, whatever your preferred platform may be. If it's Instagram, you can go to Instagram, you'll see the latest pictures, and your picture will be shared. The same if you prefer Facebook, you can go to Facebook and look at the different pictures. If your preference is for Twitter, you can do that as well. And I want to acknowledge all of those who are following us on Facebook, LinkedIn, and YouTube. Before I tell you what is coming next, a wonderful event. Thank you for those who shared. Apologies, we regret those technical difficulties, but that happens. Now, the next special event on your calendar should be Teach to Reach Connect. If you do not know what Teach to Reach is about, the next edition will be on the 16th of June. But ahead of that, we'll be sharing in every participant in this special event. Over 8,200 who registered will be receiving the Teach to Reach 7 report. Everything we learned about the power of interpersonal communication, the power of peer learning, implementing Immunization Agenda 2030. And we're still working out the branding details, but this is not the final cover, but we'll share that soon. Now, Teach to Reach 7, the key point is that these events reach very large numbers of health professionals, primarily from national, region, district facility. You can see the distribution here. And it's really about the intersection of global and local narratives, what some call consultative engagement. And we're very pleased to announce that in the coming weeks, or rather the coming days, we'll be sharing a little bit over a year after the launch of the Movement for Immunization Agenda 2030, the first 3 implementation case studies. They're part of the Teach to Reach report. They're part of Immunization Agenda 2030. And this is what we'll be sharing. Westam Fai, midwife, who was sent to a rural outpost in Senegal, who had little experience of running an immunization facility. And she got help from scholars in different countries, everything from how to keep the vaccination, the immunization registries, to how to organize a peer support program. And she achieved spectacular results, increasing Penta 3 coverage from 8 to 80%. So that is the results, the outcomes, the beginning of the outcomes of IA 2030 and the Movement for Immunization Agenda 2030. Dr. Frank Monga is a district medical officer in Lumumbashi. It's the second case study of implementing Immunization Agenda 2030, introduced a token scheme to catch up on ZD children. And Maria Fernanda Manzan from Argentina, who runs a primary healthcare center in Corrientes, Argentina, and who's focused on enhancing coverage in a nearby slum area. Once again, she is a movement leader of Immunization Agenda 2030, shares her story of how she managed to obtain spectacular, impressive results, practical ones, and how she attributes these results and her ability, the ideas, the practices that she was able to then adapt and localize to the Movement for Immunization Agenda 2030. So that is what is coming in the days, weeks, and months ahead. We'll see you at Teach to Reach on the 16th of June, and we'll be asking you to update us on how you're doing in the movement, how are you doing with your local challenge, how you are doing with your leadership, where you work, in order to understand and better support you now and in the future. Once again, thank you for having joined this event. This was the celebration of World Immunization Week. Colleagues from all over the world, over 8,000 participants. What an amazing event today. Thank you for having joined us, and we wish you well. And we're now going to switch to actually show these slides. Just go back here. So spending 2 minutes and highlighting those from Anglophone countries in this slideshow. So Ali Hassan Elmi from Somalia, Salimata Kantibo Diedou from Senegal, Mohamed Hashim from Pakistan, Salimata again from Senegal, the second picture, Omolara Adeyemi, El Ramaji Mainbi, Aoula Abdullahi Yakasa from Kano State, Neila Dugan from Lebanon, Yomi Juliana Newton from Lagos State, Moussa Traoré from Mali, Saikou Jallo from Gambia, Charles Ndé from Kinshasa, Mohamed Ahmed Noor from Mogadishu, Somalia. Over to you, Charlotte.
Okay, Reda, here is Dacia Boniface is from Burkina Faso. Magaji Ubale Ado, that's from Kaduna State, Nigeria. This is still another photo. We have Unisa Ahmad from the Primary Healthcare Center in Takusite in Nigeria. Banyonia Monomosi Lucy, she's from DRC, French speaking. Amos Katin Ibrahim, that's from Adamawa State in Nigeria, Yola South Local Government Area. Chaduli Ben Chaduli, that's from the Comore, is French speaking.
Great, I wasn't sure if you'd be able to read that one.
Islam Jah Akhtar Mohammed, that's from the Sakari Community Health Center in Afghanistan, Sakari Bagh. This is Facine Sylvie, that's from Burkina Faso, Ouagadougou. Rohenje, that's from Rivers State, Nigeria. Jerakula Christophe, that's from a health center in Chad. Dr. Mariat Soleye, that's from the Quranic school at Ilorin, Kwara State, Nigeria. Salifu Alio, that's a consultant vaccine manager at UNICEF from Niger Republic. Sitana Ahmed El Said, we already saw that is from Sudan. Adamu Galadima Dangona from the University Clinic premises in Nigeria. Dr. Soro P. Musa from Katiali Village, Danria Health District, that's Côte d'Ivoire, French speaking. Amo Yetunde Ololade, that's from the General Hospital, Lanlate, Oyo State, Nigeria. We have here Inago, that's from Côte d'Ivoire, Ivory Coast. Ajay Patient, that's from the Maidala Ward, Suleja Local Government Area, Niger State, Nigeria. Marie Milan Clermont, that's from South Haiti, French speaking. Sadiq Nasiru Garba, that's from the Ikra National Primary School, Potiskum, Nigeria, Yobe State. Asen Kalengad is from DRC. Wei-Ling Ong, that we listened to earlier on from Myanmar. Salifu Alio from the Belbeji Health District in Zinder region, that's in Niger Republic. Friday Koma, that is from Mukulu Bridge on the Luapula River fishing camp in Zambia. Francois Wangwa from Madagascar. Dr. Muram Ali from Pakistan, Kachura Village, Kadu. Nimubona Marie Rose, that's from Burundi. Akech Buro Kwol Akech from South Sudan. Fayadumbo Oliano from Guinea, French speaking. Sandra Shanice Misiribi from Shinyalu Model Health in Kenya. Abdul Muhaimini from Bermo Health District in Niger still. Adeyanju Solomon Oyetoyan from the Penn Cinema Ifako Ijai Local Government Area in Nigeria. A.G. Ilunga Kumimba Patrick, that's from DRC. Dr. Ja Olivier Raphael, he's from Ivory Coast. Dr. Ehsan Ghani from the district of Walapindi, Afghan refugee camp Taxila in Pakistan. Dr. Edi Musipi, that's from DRC, Lumumbashi. Olubukola Soji Taiwo, that's from the Buari Area Council in Nigeria.
Nyangoran from Ivory Coast. Ali Usman Yahaya from Niger. Hawa Umar Buhari, we heard from Hawa. Nyangoran again from Ivory Coast. Fatoumata Danso from the Gambia. Rafara So Ani Aina Yvonne Cunegonde from Cameroon. Olatunde Ojeinde from Ogun State, Nigeria. Dr. Syed Amar Hussein Shah from the district of Muzaffargarh, Pakistan. Dr. Hemant Adhikari, Sanbadra, India. Odukoya Adesoji Olatunde from Imeko, Afon LGA in Ogun State. Abdul Basit from Gilgit-Baltistan Province. And I want to mark a pause here to acknowledge and recognize all of the different places that are represented. And I want to take a little bit of time to just scroll through, and you'll see many places. This is in alphabetical order, so if you're looking for your location, note the Adult Immunization Clinic in Kolkata in India, Goma Airport in DRC, an informal settlement in South Africa. You can see here we're just at the B's. This is in alphabetical order. Bondo Sub-County Hospital in Kenya. You can see how many local places where immunization happens, where vaccines work, represented in today's event. I'd like to ask you to offer a round of applause to all of the health staff, the immunization professionals who work in these different locations, even as we continue to scroll through and go back to the photos that have been shared. 845 immunization staff shared in just a couple of weeks. Dr. Amir Bashir from Pakistan, Nigeria, Ghana, Nigeria, Sani Musa Futuk, Ghana. You can see over 60 countries represented. And no, we have not yet shared all of the photos. We're still posting photos every day. We encourage you to go and show your solidarity with your colleagues. As we go through these, a like, a share can help show that vaccines work, so you are contributing to the life-saving work of vaccination by simply sharing your colleagues' photos and showing some very dramatic places and locations and difficult and challenging environments. So we're looking forward to seeing these. We'll go through the list of names as well, as you can see here. Again, in alphabetical order, you'll find your name. We'll share the full list with everyone. We really want to honor and recognize everyone who contributed today. You can see here Dr. Annika Scott. We did not hear from her today, but she and her team in Guyana submitted many photos. Harira Suleiman from Nigeria. Ibrahim Abdullahi Maikano, we heard from today. This is a long list, but it's a credit to the commitment and dedication of members and leaders of the movement for Immunization Agenda. Musa Sanogo from Mali, Mukhtar Usman Getso, Sadiq Hassan. Just picking out a few of the very many names as we go here through this list. We will not make it to the bottom of the list today, as we want to go back to the photos. It's amazing, no one has left the room. If you need to go, please do. If you have pressing professional obligations, please go. But I see everyone is staying in our Zoom studio, and it's the same thing online. These are remarkable pictures showing the daily work of immunization and vaccination. We hope you're enjoying these photos, and this is just a starting point, because we were literally overwhelmed by how many photos and compelling stories you shared. This is the final portion of our celebration following World Immunization Week. What you're seeing on screen are photos shared by immunization professionals themselves, photos they took during or before or after World Immunization Week that show really the reality of what it takes, how it takes people to make vaccines work. We celebrated today. We heard many compelling stories. We had, of course, some technical challenges, but that's okay. That's just part of the story. You can still share your photos. I see many people asking if it's still possible to share photos. So yes, Immunization Week for immunization professionals actually takes place all week, all year. So we'll be keeping the photo submission open and look forward to next year's event, and we'll keep posting new photos and photos already received. We simply haven't been able, there have been too many photos to post each one. So for those of you who are in the room, I hope you're not disappointed. Obviously, if you're still here, I hope that is what is the case. There's just so many beautiful pictures. If you have not seen your photo yet, be reassured, it will be posted. Please keep an eye on our social media platforms. You can show solidarity with your colleagues. And I'd like to ask those of you, because there's so many of you still in the room, if Charlotte hasn't posted already the links to the social media so that you can actually show your solidarity. Go and like and share and show your colleagues what this movement for Immunization Agenda is actually doing and how it is by connecting health professionals, immunization professionals from all over the world, that we can make progress together, as we heard many compelling stories here. That's it for today. Glad you could join us for this special event. Looking forward to Teach to Reach, and again, we look forward to sharing all of the photos coming in. Now some of the comments received online, we actually haven't had time to do that. Just to acknowledge a few of the people who joined. So Falalu Abdullahi said he was happy to join. Suma Shurehu, Dr. Traore, Lydia, and Tommy Gumede, Sadiq Ahmad, Samuel Ajansan, Lara Adeyemi, Ibrahim Aba, Abu Khalil, send in your messages and comments. Thank you once again. We'll see you on the 16th of June, and look forward to following up on how you are doing in the movement, how you are implementing against your toughest challenges, and what you are doing by connecting with each other in order to make a difference. Take care.